Welcome to the program. I'm your host, Neil Howard on Health Professional Radio. Thank you so much for joining us. In this segment, we're going to be speaking with returning guest, Dr. Jeffrey Dlott. He's joining us here as Medical Director at Quest Direct to talk about the new Future of Personalized Healthcare Insights Study 2022. It was conducted by Leaf Group in collaboration with Quest Direct and Well+Good. Welcome back, Dr. Dlott. How have you been?
I've been great. Thank you for having me back.
Well, thanks for coming. For those who may not be familiar with you as a contributor, give us a brief look into your professional background, if you would, and then let's jump right into this Future of Personalized Healthcare Insight Study.
Absolutely. So, Jeff Dlott, and I am a physician. I trained in clinical pathology and bleeding and clotting disorders in particular, but my career has taken me to Quest Diagnostics for the last 16 plus years, and I've been pleased to be the medical director to launch and still am the medical director for Quest Direct, our direct-to-consumer offering.
Future of Personalized Healthcare Insight Study 2022. Why was it conducted, and what were some of the key findings?
Great question. So the Future of Personalized Healthcare Insight Study, it sought to understand perceptions and preferences that consumers have around telehealth, health data usage, and tech adoption. From delayed access to care, or scheduling conflicts for fear of contracting COVID-19 while sitting in the lobby of one's provider, have kept consumers out of their providers' offices, and it's impacted, as a result, their healthcare journey, all because of the pandemic. So whether it's choice or by force, some consumers have put off seeing their primary care physicians, even for their routine physical. In fact, nearly a quarter of the people surveyed haven't had a physical in 2+ years, but change is coming. People are looking for a more personalized healthcare experience, and they're looking to three things. They're looking to telehealth, direct-to-consumer or consumer-initiated testing, and data tracking. Each of these help consumers take healthcare into their own hands. And what we're seeing is that people are enjoying the benefits and conveniences of these new class of tools.
You know, we talk a lot about how the pandemic has caused a lot of these changes in healthcare, a lot of the people not going to the doctor. Is the onset of the pandemic the only reason that there's been so much talk about personalized healthcare data in recent years?
Another great question. In fact, we started to see a shift to more consumerization of healthcare prior to the pandemic. In fact, we launched Quest Direct in 2018, keeping in mind we wanted to bring actionable diagnostic insights directly to health-minded consumers, but certainly the pandemic has accelerated this. Personalized data and increased accessibility to purchase tests from one's home have allowed people to have a tighter control of their healthcare journey and really sit more comfortably in the driver's seat. At Quest, we believe that people should be empowered to take charge of their healthcare decisions. That is, actionable insights from laboratory is key to this. So Quest Direct is designed to do this, to empower people to access and identify their information and data readily.
Is a reimagined healthcare experience the same from the perspective of the physician and the patient, or do they vary greatly?
We have observed that preventative care is really a critical piece to maintaining health and wellness. Yet it often gets pushed aside for various reasons. Could be insurance issues, it could be accessibility, could be inability to forge a comfortable doctor-patient relationship. These attitudes and needs and expectations around how people want to receive care is shifting, frankly. And access to affordable diagnostic testing is quickly becoming a must-have. And the ability to track and make sense of one's data is critical to this. So here's a couple statistics from the study. 2/3 of the people surveyed prefer to have discussions of their lab results during their visit. And 34% said that at-home lab testing options would be part of their Reimagined annual preventative visit. So whether it's personalized data, increased accessibility to purchase one's tests, or access to telehealth services, these are the three things that are drivers to enable folks to have a tighter control of their healthcare journey.
Are there certain types of tests that people prefer to order as opposed to going to their normal physician, or is it across the board diagnostics?
Yeah, so we're seeing both. So let me give you an example. So at Quest Direct, we offer more than 50 tests, and they range from general health, like a men's wellness panel, a women's panel, but we also check for heart health, or we offer testing for heart health, to sexually transmitted disease testing. And there's an opportunity, and this is more than just a transaction here. There's an opportunity, when appropriate, for some of these testings to receive a prescription for drug treatment. So Quest Direct, it offers the same quality tests that doctors and hospitals receive. So there is no difference between the testing offered on Quest Direct and the test that one's doctor orders. And the consumer has direct access to the results through our secure portal, and our name of our secure portal is called MyQuest. They have the option to share their data, if they like, with their doctor, family, or friends, or review the results with a telemedicine partner. So we aim to reduce the barriers that people have perceived about access to lab testing. You know, those barriers include lack of time, inconvenience, costs, lack of a health plan coverage, or even privacy concerns like with the STD testing. And we are continually expanding our access through our retail relationships, telehealth collaborations, and technology integration. But what I want to drive home is that Quest Direct is a complement to traditional healthcare, and I'd love to share an anecdote with you.
Absolutely.
Because it engages people. Well, let me jump straight to the anecdote, and then I'll make my point. This is a true story, and this is pre-pandemic. A friend of mine was a middle-aged man having some prostate issues, family history that's concerning, couldn't get into a urologist for about 8 weeks, and knew that I had involvement with Quest Direct. So he called me up, and he set up his account online, scheduled an appointment at the patient service center, and he purchased a PSA result on himself. And the result came back normal. But when he finally got in to see the urologist said he didn't see anything concerning. He said, "I'd like to see you back in a year." He said, "But we really should get a PSA on you." And my friend produced his result. He said, "Here you go, doc. I just had it done while waiting to see you." And he told me he loved the control, the timing. He just loved being in control. So what we believe at Quest Direct is that this offering engages people in their healthcare decisions and prepares them actually to partner with their healthcare provider, as in this case.
The pandemic has caused lots and lots of changes. We've spoken about those. Do you think that many of the changes will actually stick and persist once the pandemic is under control, or we're at some type of new normal, or will things slowly get back to the way that they were?
Yeah, again, great question. So the survey showed that the things that are important to people are personalization and meaningful insights, as well as convenience and access. 88% of the respondents in our survey said that they'd like more access to personalized healthcare data, and 61% said on-demand healthcare would improve their overall healthcare experience. So to answer your question directly, not everyone is an early adopter, but we think that over time, these tools and services are going to become a mainstay.
Well, give us a website where we can learn much more about Quest, if you would.
So let me give you the website for Quest Direct. It's Quest Direct, all one word, .Quest Diagnostics, all one word, .com.
Jeff, always a pleasure. I'm hoping that you'll come back and speak with us again.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. Jeff Dlott, Medical Director at Quest Direct. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.